I'm Anthony Hill in Tampa.
It's important because it helps keep them safer when we're out in public. Like when you have a newborn, you don't bring them out until they have their immunizations because you don't want them to get sick.
Rena Hammond is the mother of 7 children,
My oldest is 15, my youngest is fixing to be 4.
and she's ensured that all of her children have been fully immunized. However, the CDC says not all parents have because they're noticing less children are up to date on their immunizations.
We've not seen diseases like measles and even chickenpox in a really long time because these vaccines are so effective.
But vaccines are only effective when taken. And though statistically, COVID-19 doesn't negatively impact children as much as it does older adults, medical professionals warn that children who aren't vaccinated are still at risk. Last year, COVID-19 was the leading cause of death among children from an infectious disease.
We had more children die from COVID-19 than we did from influenza or even from pneumonia.
And this is why the CDC is trying to make vaccines more accessible to children through their federally funded Vaccines for Children program.
Is critically important to protecting those communities, often which are Black and Brown communities who are disproportionately impacted by low income, and to make sure that the communities at large and our families and our own communities stay safe from these vaccine preventable diseases.
Through the program, children who are on Medicaid or underinsured can receive all of their immunizations free of charge.
Whether that's measles, mumps, rubella, polio, diphtheria, tetanus, flu, COVID.
Here are the COVID vaccination guidelines for children. It's recommended that children 5 years and older get 1 dose, especially if the last time they were vaccinated was in September. And 2 doses are recommended for children between 6 months and 4 years old.
And unfortunately, babies under the age of 6 months can't receive a vaccine yet. So making sure that the people around them are vaccinated is really important to keeping that baby healthy too.
There's also an option for vaccine co-administration. That's when they give your child more than 1 vaccine at the same time.
It also just allows children to get their vaccines up to date as quickly as possible so that they're protected more quickly than when we space vaccines out over a long period of time.
And for more information on the Vaccines for Children program, just head over to our website, abcactionnews.com, where I've posted more information. In Tampa, I'm Anthony Hill, ABC Action News.